Great, we're live. So hello and welcome to another one of my ScienceWorks live webinars. I'm your host for the day and my name is Sally. And joining me live today, three panelists to whom I'll give an introduction just later. And in this session, we hope to answer some pressing questions and maybe questions that you also have on the effects of the pandemic on mental health and how best to cope. So joining me today from Genoa, Italy is Dr. Gianluca Serafini. He studied medicine, following which he became a psychiatrist, and later he obtained his PhD in psychiatry, early intervention psychosis at Sapienza. Please correct me if I'm pronouncing it wrong. University of Rome. He is actually the associate professor at the University of Genoa section of psychiatry. He is an active researcher, being the author of more than 230 publications in peer-reviewed international journals. He is also the editor-in-chief of Behavioural Sciences, MDPI, and associate editor of many peer-reviewed international journals. So thank you, Dr. Serafini, for joining us live today. And also joining me from Nashville is Dr. Catherine Spencer. Dr. Spencer is a licensed psychologist and also an assistant professor of clinical pediatrics at the pediatric hospital at Vanderbilt University Medical Center. Her experience is in child and adolescent psychiatry, and she will be sharing her clinical insights and case examples related to her experience of children and adolescents during the pandemic. We also have joining us live from Canberra, Australia, Dr. Amy Dawel, and thank you very much, Dr. Dawel, for joining us. I know it's quite late over there. She is a cognitive and clinical psychologist at the Australian National University, and she's currently conducting ongoing research on the effects of COVID on mental health and well-being. So in spite of all these many time gaps and your very busy schedules, on behalf of my science work and the audience, I thank you all of you very much for your time here today. So that said, let's hop in straight to the question. Now, the spread of the pandemic is making people around the world anxious. I mean, this is a situation that nobody has had the chance to deal with before. Social distancing is, for one, is a relatively new concept to people. Dr. Serafini, can I start by asking, what does the latest research tell you about the most relevant psychological and psychopathological effects of COVID-19 and also mass quarantine?
Yes, thank you very much, Sally, for this presentation. And it's my great pleasure to share with you the slides. Do you see the slides?
Yes, perfect.
Perfect, thank you. So, thank you very much for the opportunity to present such a topic. And I will generally talk about the impact of COVID-19 on mental health. And as you may see, this is the recent coronavirus disease pandemic in the world. And we have more than 100 million confirmed cases worldwide and more than 2 million of deaths. And this is really a tragedy for the human being. And here you may find a comparison between the H1N1 pandemic flu at the beginning of the 19th century and the new age of pandemic. As you may see, we have, according to these pictures, some interesting similarities. And generally speaking, viruses and bacteria marked the history of our society, even deciding the destinies of entire populations. Infections are really endless threats, which are perhaps necessary for the self-affirmation of the human being. And at the beginning of this terrible tragedy, we have seen many publications in the field of mental health, psychological interventions in particular, for guidelines for emergency Psychological crises have been performed worldwide. The platforms to provide the psychological counseling have been created. Community mental service personnel try to provide both medical and mental health care. However, psychological interventions need to be adapted based on different contexts. And this actual tragedy related to the pandemic is really a new type of stressor because when compared to natural disasters, wars, or international mass conflicts, this is a new type of trauma. In those emergencies, usually the trauma is localized, is limited to a specific region, and to a given time. In this case, is not so because of this pandemic. In this pandemic, the threats can be everywhere, and everyone, the person next to us, may carry the threat. So about COVID-19 infection, we may see that at least 4 groups of people, of subjects, may be at particularly risk. The first is those who have been directly or indirectly in contact with the virus. The second is those who are already vulnerable to biological and psychosocial stressors, such as people with mental health, with mental problems. The third is frontline healthcare workers, and then we have the people who are usually following the news through the media channels. These are the most relevant, the most frequent psychological reactions of the general population. Low mood and high irritability are very, very frequent, but unfortunately, we may have disabling loneliness, uncontrolled fear, pervasive anxiety, frustration, and so on. And unfortunately, when these symptoms are associated with low resilience and low social support, they may develop the onset of psychiatric conditions. This is from Nature. It has been published this month. And here the authors stressed the importance of anxiety and depression in the general population. As you may see, the percentage of people experiencing anxiety and depression enhanced significantly, and the distress stems from people limited social interactions, from tensions among families, from fear of the illness, and so on. And the most anxiety and depression may be even related to quarantine. Quarantine is the separation, is the restriction of movements for subjects who have been potentially exposed to the infection. So quarantine is really different from isolation. Isolation is the separation of people who have been diagnosed with the contagious disease. Unfortunately, due to quarantine, more than 1 billion of people worldwide have been forced to reduce the social interactions. And importantly, quarantine is a significant predictor of post-traumatic stress symptoms. In particular, children who have been exposed to quarantine, who have experienced the quarantine, may be at risk, at higher risk to develop a post-traumatic stress disorder. And even parents who have been quarantined reported a significant prevalence of trauma-related conditions. And we have many predictors of the psychological impact during quarantine, of the relevant psychological impact of pandemics. The younger age, the lower levels of educational qualifications, the female gender, and having one child as opposed to no children. And this is mainly related to the fear for subjects who are near us that may be developed to the negative consequences of the pandemic and the quarantine. We have also some pre-quarantine predictors of psychological impact. The most important is the history, the positive history of psychiatric illness, which is a significant predictor related to the onset of anxiety at 4 or 6 months after the release from quarantine. And unfortunately, alcohol abuse is another very important leading cause of mortality, and it's really associated with the quarantine, and not only with quarantine, but even with the pandemic. Unfortunately, the potential effects of long-term isolation on alcohol abuse are really unknown. But we can suppose that having been quarantined and living in high-risk location are both significant risk of alcohol abuse. Another important observation needs to be performed about healthcare workers. Healthcare workers felt greater stigmatizations, exhibited avoidance behaviors, and they may be significantly affected psychologically because they may develop hunger, fear, frustration, guilt, helplessness, and they may be more likely concerned about infecting others, in particular family members. And we conducted this study in Italy about general practitioners, and we found that general practitioners with depressive symptoms reported even more frequently helplessness, spent more time searching for COVID-19 information using social media, perceived less appropriate personal protective equipment, and importantly, they may manifest significant anxiety, significant insomnia, worse quality of life. And importantly, in this study, we found that anxiety and depression are both potential mediators of the association between sleep and worse quality of life. And this is a very recent article about general practitioners, about frontline healthcare workers. This is a systematic review and meta-analysis in which the authors stressed the importance of lack of control, persistent stress, higher workload, difficult ethical decisions, and so on. Importantly, this psychological distress in healthcare workers need to be addressed immediately because, and unfortunately, in many contexts, this distress was denied or dismissed. Another important subgroup at risk is related to children and young subjects who may develop during pandemic substance abuse, gambling, domestic violence, child maltreatment, change in the and disruption of social networks. According to COVID-19 onset, governments worldwide ordered the school closure. So more than 200 million children were confined to their homes. And the prolonged school closure and home confinement may be really negative effects on the children's physical and mental health. Another important subgroup is related to elderly people, to elderly subjects who may be more vulnerable to the tragic effects of this pandemic because the case fatality in this population is higher than other populations. They may be more cognitively impaired and they may suffer from lower social support. They may be not adequately treated, and they may be the target of stigma, discrimination, and so on. And another important observation is linked to suicide risk. The pandemic, the quarantine are related, no doubt, with and increase the risk of suicide because the likely adverse effects may be exacerbated by fear, self-isolation, entreatment, loneliness, hopelessness, which are all related to the enhanced suicidal risk. And providing the community support for these living people is really fundamental. Suicidal behavior is related at the time of pandemic predominantly to social isolation, economic problems, uncertainty. In vulnerable people, these situations are really tragic because they may be low resilient to stressors. They may live in at-risk situations or locations, and importantly, they may develop depression, anxiety, alcohol abuse, as mentioned, and so a higher suicidal risk. We conducted another study in Italy in which we found in a large sample in this survey that poor housing is linked to increase the risk of depression. And importantly, living in small apartments is associated with more than 2 times the risk of depression. I have to conclude with stressing the bidirectional association between mental and the physical health. Because in many situations we found that depression, anxiety, post-traumatic stress disorder are all related to physical symptoms, and physical symptoms are related to mental conditions. Unfortunately, we don't know the real long-term cost in psychological terms of a pandemic, and we have to conduct a longitudinal study in order to understand what is the real effect of social isolation on mental health. We published this other paper in which we stressed the complex consequences in terms of deprivation related to pandemic, and we strongly support the cry for help of vulnerable people, of vulnerable populations, proposing a call for action in the field of mental health. Finally, these are my take-home messages. The pandemic is really a huge challenge for the mental health system. However, it needs to be considered even an opportunity for improvement. Importantly, culturally adapted and cost-effective mental health emergency systems based on evidence-based intervention methods are recommended in order to reduce the terrible burden of this pandemic and the psychological impact of this infection outbreak. Thank you very much.
Thank you, Dr. Serafini. The research speaks for itself, but I want to touch base with support. So you mentioned that providing support is really fundamental to mitigate this situation. Is it possible that in this critical moment, there is a mental health shift, and is a direct strategy aimed to manage the psychological issues related to the COVID-19 crisis and also its consequences? And sure, there are multitude of unexplored, unknown long-term consequences that we are currently probably not aware of. But do you think that there is a direct strategy like really aimed at mitigating the situation currently lacking within the community?
Yes. Thank you very much for this question. I believe that the pandemic may be, as stated, an interesting opportunity for improvement, because we need, in order to comprehensively prevent the burden of pandemic, to implement our guidelines for emergency psychological crisis. We need to implement the more accessible platforms online platforms to provide the psychological counseling. We need to implement a community health service using telemedicine, using telepsychiatry, telecounseling, and so on. And we need to monitor the long-term consequences of the pandemic. We need to support the cry for help of these people, of these vulnerable subgroups of people who are really more exposed to the negative effects of a pandemic. I believe that we have we have to follow this direction because we are in the middle of really of a tragedy worldwide, and I believe that these strategies may enhance the resilience in the general population, and are really aimed to fight this tragedy.
Thank you very much, Dr. Serafini, and thank you very much for joining. I know that you have a very tight schedule this afternoon, so thank you very much for joining. And for those of you who've asked in the chat, yes, we'll be sharing Dr. Serafini's slides, so you can access that. And
Yes, absolutely.
thank you very much for joining. So at this stage, perhaps I will hop to you, Dr. Dawel. So it is one thing to be well informed, especially in the measures to. No, before that, I would like to actually retrace my steps back to this similar study that you conducted, which was in fact the first study to survey a representative sample of Australian population at the early phase of COVID-19 pandemic, Dr. And could you please share with us your findings?
Sorry, just getting the slides up here. Thank you. Look, we were having a chat before the webinar today talking about the situation across the globe, and I think Australia offers a very unique case study relative to what's going on in some other places in the world. We're still sitting at a stage now where we have less than 1,000 deaths and less than 30,000 cases overall here. So it's really been business as usual for most of it, apart from having an early lockdown and then kind of spot lockdowns in space. But what we are still seeing is huge effects on mental health across our population. So the data that I'm going to present today will give us a bit of an insight into how a stressor like this, even when you have these very low case rates and death rates, can have a huge impact that can be sometimes hidden in our populations. And perhaps I think there's a couple of lessons in there for how some of people who are being less directly affected across the globe are still having these hidden costs for mental health. So our study used a market research panel with close to 1,300 Australian adults using quota sampling, representative age, gender, and geographic location. And so we started running right at the end of March, which was when we were really starting to head into lockdown for the first time in 2020, and was running on a fortnightly basis across the next 3 months. And we're just about to run a final follow-up in the next week or two to check on the longer term outcomes, but unfortunately we don't have that data just yet. The first set of data I'm going to talk about today comes from that first wave, and it's a set of cross-sectional data that gives us some insight into the things that were impacting the people. And some of them really fit in with what Dr. Serafini was talking about before, but you'll see a few things that are a little bit surprising in this space too. So just to give you some context about the time now that we have to kind of think back to a time when things are really just ramping up. At this point in time of the survey first running, globally, we're talking about there being around 36,000 deaths at that point in time compared to the 2.5 million that we have today. In Australia, we'd had 19 deaths and really just those lockdown measures coming into place over the last 2 or 3 weeks at this stage. The sample that we have has 50% female, 50% male, representative across states, ages, and around 70 to 80% living in cities and 20% in our more rural areas of Australia. We do see what a lot of populations are seeing across the globe, which is much higher rates of depression and anxiety than we typically see in our populations. So we're talking about 2 to 3 times higher than usual, even at these very early stages of the pandemic. When we look longitudinally, what we found is that the vast majority of people were still very low on depression symptoms and also anxiety symptoms, but we get a couple of different trajectories for people who are experiencing these symptoms, where we're getting either increases over time for around 10%, and another 10% who are dropping off, but still staying in that moderate range where they're usually across the caseness barrier. For anxiety, the picture looks a little bit different. We have people who dramatically drop from the start and dramatically increase here in yellow, but also a group that stay very stably high across the period as well. Again, sort of in total here, around 20% of people who are experiencing significant levels of anxiety at least one point across that first 3 months of shutdown. In our models, we brought in all the same sorts of background characteristics that Dr. Serafini was talking about before, and find that we get typical effects with mental health problems, existing neurological conditions, loneliness and isolation, being female being a risk factor for mental health problems in this context, younger age, recent adversity, and Australia had also been through a very severe bushfire season just beforehand. So a lot of places had already been in a sort of semi-lockdown because of the air quality and the threat there as well. But on top of this, what we find is that the financial distress due to COVID and the work and social impairment due to COVID were huge risk factors. So it wasn't that necessarily people losing jobs was a problem, it was the financial stuff that was coming in on top of that. Australia had a really big push around supporting workers through a job seeker and a job keeper program, which we're pushing up our welfare payments, and we believe that's been quite protective here, both in terms of our economy and mental health as well. The surprise is that we found direct COVID exposure, whether that was being diagnosed yourself or being in quarantine or having had contact with somebody who had a positive diagnosis, wasn't predictive of these higher symptoms at this very early stage in here. One of the things that we look at when we see that data is that a lot of people who were having this early direct exposure were people who were coming back from overseas, so had often been on holidays or at least had the means to be able to travel and may have had protective factors sitting around it. So for us in these early stages, what we saw is that COVID-19 had very little direct effect, but considerable indirect effects. And I think we really need to keep in mind what these are going to be and make sure that they don't get hidden in amongst the chaos and the crisis that are hitting the rest of the world. Most people still had stable low symptoms, but we have this kind of 20 to 25%, so around a quarter of our population at risk of having very high anxiety and depressive symptoms, which are exacerbated by loneliness, isolation, existing mental health conditions, and magnified for young people and females. So there's a real push for these high quality data sets and assimilation across cultures and countries with consideration of the context in which they're happening. And of course, a need for ongoing policy support and social capital to minimise mental health impacts there, Sally.
Great. Thank you very much, Dr. Dawel, for that. Retracing back to the line that I started with earlier, I mean, it's one thing to be well informed, especially in the measures to mitigate the transmission of the virus, but certainly doesn't help, having this constant exposure to anxiety-provoking topics related to health and, socioeconomic crisis. Has factors like inadequate supplies, inadequate information, or maybe too much information, especially the circulation of false news on social media, also have an impact on the overall levels of fear and anxiety?
Absolutely. That's also another focus of what we've been doing in our research, trying to understand those media consumption patterns and how they're influencing psychological distress and also behaviour change as well. So I'm going to start with some good news here. We seek news from those we trust. So the more we trust a particular source, the more we're likely to go and spend time seeking news about COVID from that. The reason why this is good news is because people in Australia are trusting doctors, most, and also government sources. And what's really important here in Australia is, irrespective of your party preferences, the trust in government is high. So there's not this kind of leaning where if the people in power aren't the people that you support, you don't trust it, you trust it full stop. The low trust areas tend to be things like blogs, Facebook and Twitter, fortunately. So we're getting less people trusting there and less people seeking their news from there. The more challenging news is that we get very large individual differences in how people are seeking information. So we found 4 clusters, a kind of balanced cluster where people are getting their news about COVID across different sources, a traditional, no social kind of cluster, but then online and high social and online and low social. And the risk factor for online and high social by far is younger age, which is perhaps unsurprising. But then we do find this association between psychological distress and more time spent on social media and online news, that we're seeing kind of this pattern across the globe. And of course, in Australia recently, we've had some challenges with Facebook and Twitter withdrawing news from those sites around different legislation that's being trying to be brought in here. And that's really a problem when we're not getting reliable news out via these sources, the onus that we have on our social media there. So I would encourage people to look to the World Health Organization for their guidelines around this, things around minimizing watching, reading or listening to news about COVID-19 that causes you to feel anxious or distressed, using trusted sources, and being kind of circumscribed about when you check, once or twice a day to stay informed, but getting on with everything else around that as well, and taking care of yourself.
Absolutely. So there was an Italian survey that was done that found that children are more irritable and anxious due to the lockdowns. And recent reports from the England Childhood Trust warned that kids and children may develop serious mental health conditions because of the pandemic, including PTSD. I mean, Dr. Spencer, this is really heavy stuff. What have you seen in your practice?
Well, thank you for having me. We've certainly seen an influx of these children in our emergency room, and from what I'm hearing across the country here in the United States. I'm going to share my slides here. All right. So this is, I think, just the tip of the iceberg. I think that like Dr. Dawel is mentioning, that we still have a lot that we don't know yet. While we know that these children are certainly at risk, and in the United States, we are definitely seeing a rise in children coming to our emergency departments, and children needing mental health services. So what are we seeing in practice? We are seeing that mental health in children were already on the rise. So from 2019, we were already seeing an increase in maybe 25 to 30% for children with suicidal ideation who were presenting to our emergency rooms. And in fact, just yesterday, our New York Times article came out kind of shedding more light onto this, that it's not just here at Vanderbilt Children's that we're seeing this influx, but just across the country as a whole. And these increased visits do pose problems for our hospitals, where we are really good at treating medical illness in children's hospitals, but it's hard to find the right resources in inpatient psychiatric treatment here in the United States, especially in certain areas. And many of these children have an increased severity of their depressive symptoms, increased severity of anxiety secondary to the pandemic, and then these, maybe not direct effects of COVID itself, but these secondary effects. And there's so many challenges that we face for children of all ages who are coming here. They may not have really great services in their community already. They may be having services, but they're over telehealth, and not all children and families are really able to maintain that or find it as helpful. Although I think it's fantastic that we've been able to maintain some mental health services that way. So we have certainly seen an increase in suicidal ideation as well. Teenagers coming in with intentional ingestions, really serious issues that they're coming in with. And some of the populations more at risk than others. Like our panelists have already said, that children who have a pre-existing mental health issue, or who have physical health issues, or who have families who maybe have housing insecurity or other significant stressors, these families are certainly more vulnerable. And in the United States, we're also seeing a disproportionate increase in vulnerability of our families and children who are Black or Latino. So this is certainly a problem that we're seeing here at Vanderbilt Children's, and all children react differently depending on their age. We know that young children may be clinging to their parents more, whereas adolescents may be isolating themselves in their room. And our school systems are different throughout the country. There's not one kind of cohesive plan for shutdown or opening, even in the same state or city. So my children are in school right now, but many children aren't. And then we may have quarantines. So we have children out of school for a few weeks and families scrambling. So it's certainly been a very difficult situation, affecting families and children. And especially young children are really looking to their parents for a model of coping. And as we know from our panelists already, adults are also struggling emotionally and physically with this. One other population that I'm seeing too are children with an increased physical symptoms that may not be due to underlying medical issues. So children with somatic symptoms kind of representing their stress and their experience. And children with neurodevelopmental disabilities are certainly more at risk. And I know that these parents are often working, trying to support their children at home. These children may have had really excellent services in school, and a lot of their therapies, like physical therapy, counseling, other social support. So these children are maybe struggling more than others. And we're seeing many children coming in with an autism spectrum disorder, increased aggression, difficulty for their family to manage at home. And they're also quite difficult to find good psychiatric placement for them after they come to our hospital. And I feel like as a whole, we are struggling to provide the best possible service for them.
Thank you, Dr. Spencer, for that. And I mean, you talked about children with pre-existing mental health issues, and I think it's not just only children, but also adults who are thriving on routines, and that everyday routine has been completely disrupted. So, do you see some specific challenges or maybe mitigation strategies that could help members, especially with autism or other developmental disorders?
Absolutely. So our caregivers can provide some support. I also think that as our school systems are getting more used to their virtual plans, that the schools are addressing some of that better. Some of the individualized special education plans have really been improving. So as caregivers, whether we're providers in a hospital setting, pediatricians, or parents, we can help families to establish a routine. A lot of these kids were used to waking up at the same time every day, going to school at the same time, having those same people in their lives daily. And we can reestablish even a small part of a routine in our normal home environment, whether that's a bedtime routine again, having meals at the same time, or just that play together time every day with the parent or caregiver. We want to have families pay attention to what their child is doing well. We've certainly noticed a lot of attention to what's not going well in the world, and we want to make sure we're noticing what children are doing well. We want to validate their feelings, not to invalidate how they're feeling. Their emotional experience, even a dramatic teenager, is very real to them. We want to be available to listen actively and to respond thoughtfully as providers and as parents. And like I mentioned earlier, be a positive role model of healthy coping. And that could be anything from self-care to managing your own emotional regulation to staying connected with people as best you can, even if you are on quarantine. And as Dr. Dawel mentioned earlier, media exposure can be a really big risk factor. A lot of our children who are already anxious, we may have been recommending to reduce access to the news and other resources. But we certainly want to limit media exposure that could be contributing to more anxiety, especially the news in the United States. We've had this pandemic, but a lot of other things happening in our country. And we want families and caregivers, providers to be correcting any inaccurate information about COVID-19 and world events. It's really easy, especially in the US on social media, for us to also have that inaccurate information. And a lot of children and adults are using that as their primary source of information versus in Australia, as it sounds. And we want one thing that can help too is that gratitude, mindfulness, recognizing the good in every day. Even if that's just a story of something positive that happened at work or at school, and then to seek support and help when needed. We certainly see families who have needed support even before the pandemic that are now coming to the hospital.
Great, thank you very much for that, Dr. Spencer. Dr. Dawel, I would like to ask this question from you, but maybe just before that, I would like to remind our attendees that the panelists will be taking in any questions that you might have. So now would be a great time to direct those questions in the chat below. So Dr. Dawel, coming to you, we have talked about the bad and the ugly. I'm trying to squeeze in a movie reference here, but can we talk about the good? Is there anything that has contributed to the uplifting of the society and the community?
Well, look, I think one of the things that we see that is really interesting around this is we asked a couple of questions about what was positive and beneficial and what was hopeful around the pandemic. And we do hear people saying things like that extra time that they have with family, or that extra time to connect with hobbies that they've had in the past, or the way in which they can support the environment by not traveling so much. We also see that people are feeling quite hopeful about the future and the kinds of things that they might learn through this adversity as well, the way that they might also increase their relationships and bonds with the people that they really care about, even if we're doing it in less traditional ways.
Right, okay, thank you very much. Perhaps maybe one final question before we wrap up, unless we have some questions from the attendees. So the pandemic unfortunately still sees no end, and this is a twofold question to both of you. What long-term behavioral changes are we to expect, even though some of it to the most part is still uncertain and unexplored territory? And at what point should someone seek professional help or be taken to see, in the case of kids and adolescents, when their anxiety has got the best of them, because kids are not likely to come up and say, hey, I'm sad. So what are the signs to watch out for? Maybe we can
I'm glad to answer that question, and I may reshare my screen if that's okay.
Yes, please.
So here in the United States, I certainly think that the length of symptom duration is something important to keep in mind, that if your child's been, or an adult's been exhibiting more severe depressive symptoms for more than 2 weeks, then we certainly want you to seek help. If these symptoms are interfering with daily activities, so if it's interfering with your ability to participate in those normal daily activities like work and school, if someone's feeling hopeless, they don't want to go on anymore, and certainly if there's any sign of suicidal ideation, more withdrawn, if they have more erratic behavior, kind of giving things away, and there's more risk if there's a family history of a suicide. Substance use as well, and we are certainly seeing an increased number of teenagers coming in with substance and dual diagnosis of a mental health issue.
Right, okay, great. And Dr. Dawel, do you want to comment on this?
I think, yeah, I agree with everything that Dr. Spencer said there. The other thing that I would jump in with is that depression doesn't look the same for everybody, and nor does anxiety. So characteristically, we think of low mood as being withdrawal and feeling sad. And anxiety is feeling nervous, but for a lot of people it can actually present as irritability or snappiness, particularly in males at times. So what we're looking for is changes in behaviour, atypical behaviour in that way as well, and just maybe checking in with somebody to find out if maybe that's how depression is for you or anxiety is for you as well.
Thank you for your input, and thank you very much for joining us today. It's been an absolute pleasure and an enlightening conversation. So thank you for your time once again. And for those of you who joined us late, you can go to My Science Work YouTube channel and catch the replay, and we'll be sharing it across our social media channels. So thank you very much. Have a great day and stay safe to all of you. Goodbye.